Welcome back to the East Meets West podcast on health and medicine. I'm your host, Dr. David Cherian. I am a acupuncturist practicing Chinese medicine in Houston, Texas, as well as a board certified family medicine physician. And this is the podcast where we talk about health and disease from both an Eastern Chinese medicine perspective, as well as the Western allopathic side, so that you can see both sides of medicine and kind of how I think about it and how they can work together in complementary ways to help you achieve the best health outcomes that you can. And every episode on here, we try to talk about a different condition. There are so many different medical conditions out there that people have. There's so many different diagnoses. And in Chinese medicine, one of the great things about it is that it is really limitless. It can be used for almost everything that you can think about. And so I like to try and go through and just find different topics. And so this episode, we're going to talk about a condition called ankylosing spondylitis. Ankylosing spondylitis, what it is, how we treat it in Western medicine, and then how we look at it in Chinese medicine as well. So let's start off with ankylosing spondylitis, and I'm going to talk about it from the Western perspective because it is a Western classification of disease, meaning we use Western methods to identify it, to classify it, and the treatments are also based on the classification. So let's start off with the Western side. So when we talk about ankylosing spondylitis, first of all, that's a big word, and it really helps to understand what those words mean. If you understand what the pieces of the name mean, you'll have a better idea of what it actually is. So the word ankylosing means stiffness or rigidity. So you have ankylosing, stiffness or rigidity, and then spondylitis. Spondyle means spine. Okay, and then the suffix itis refers to inflammation. So for example, if you have arthritis, you have inflammation of the joint. If you have pericarditis, you have inflammation of the pericardium. If you have hepatitis, you have inflammation of the liver. So itis means inflammation. So you have spondylitis, spine inflammation. So you put it all together: ankylosing, stiffness, rigidity; spondylitis, inflammation of the spine. And so ankylosing spondylitis essentially means a inflammation of the spine that results in stiffness and rigidity. Ankylosing spondylitis. And there's lots of different types of inflammations and joint inflammations, but in ankylosing spondylitis, the focus is really on the large joints or the axial skeleton, meaning the main spinal column and the major joints that are connected to it. So there is one joint that is a little more specifically referred to or considered an ankylosing spondylitis, and that is the sacroiliac joint. And just like we talked about with breaking down the words in ankylosing spondylitis, sacroiliac, if you understand what the pieces mean, it'll help make more sense. The sacro refers to the sacrum, or the lower part of your spinal column in the back, the very lowest part of it. It's the base of your spinal column, the sacrum. And then iliac is it's the ilium, or the big side bones of that make up your pelvis. And so sacroiliac is that joint that connects the lower part of your spinal column to the pelvis. And in ankylosing spondylitis, that is the main joint that is affected. And it's a very specific joint that gets affected. And so what are the symptoms you're going to see in ankylosing spondylitis? Well, it varies from person to person, but the main consistent common symptom is back pain. And like I said, it's that sacroiliac joint, that low back. And the type of pain in ankylosing spondylitis is a little different than other types of pain. It tends to be more severe at night during rest and sleep, and it can get better with exercise. So a lot of different types of pain, they get worse when you exercise, when you exert yourself, when you are putting stress on it. But ankylosing spondylitis is a inflammatory type of arthritis, and it tends to get better with exercising. You can also have morning stiffness with ankylosing spondylitis. And morning stiffness, if you've never had it, means you basically feel more stiff, and it tends to happen in the morning when you first wake up. And then after you start moving around and you start getting your joints active, then the stiffness goes away and it becomes less and less. But in the morning, that's when you notice it the more right away, first thing in the morning. So if you have stiffness in the back, you find it difficult to bend, that is another symptom of ankylosing spondylitis. Now, I did say that the sacroiliac joint, or that low back joint, is the most common joint that can be affected in ankylosing spondylitis, but it is not the only joint, and there are other joints that can be involved. Some of the other joints that are commonly involved are your hip joints, your shoulder joints. You can have involvement in the knees and in the fingers. There's something called dactylitis, or sausage finger, and that's basically when your finger just becomes really swollen, really big. It looks like a sausage, and we call that sausage finger or dactylitis. And that is also from inflammation. And so, again, most everyone's going to have back pain, low back pain at the SI joint, but you can also have other joints involved. And then beyond joints, there are what we call extra articular manifestations, or evidence of the disease outside of joints. So ankylosing spondylitis typically involves joints. It always involves the joints, but you may also have other organs that can be involved. And there's three organs that are very classically involved. There is the eye, when you can have inflammation in the eye. You can have the gut be involved, where you have inflammatory bowel disease like Crohn's disease or ulcerative colitis, causing inflammation in your gut. And then the last one is the skin, and you can have psoriasis. So your eye, your gut, your skin can also be involved if you do have ankylosing spondylitis. And you do need to also be cautious, because you may actually have a different disease, like, for example, psoriatic arthritis. You can have psoriasis as well as arthritis, and it can seem very similar to ankylosing spondylitis. And so that's why it's important to not just try to diagnose this on your own or on the internet, but to actually work with a doctor and have them evaluate you, and somebody who's really familiar with these various conditions and what the nuances are between each one. So that's a little bit about the symptoms and what you may feel. Now, when you come to the point of trying to diagnose ankylosing spondylitis, a big part of it is really the symptoms that you're having. That is a big and significant part of making the diagnosis of ankylosing spondylitis. But in addition to that, there are lab as well as imaging studies that can be done to help clarify the diagnosis. And I'll break down each one of those separately. So first of all, when we talk about lab tests for ankylosing spondylitis, you're mainly looking at a couple things: inflammatory markers like ESR and CRP. Those are common inflammatory markers. They're not specific, meaning they can be elevated in a wide variety of conditions. It does not mean that just because you have an elevated ESR or CRP that you have ankylosing spondylitis. It could be any type of inflammation that's going on. But oftentimes in ankylosing spondylitis, you will have an elevated ESR and CRP. And then the other main blood test that's done that's a little bit more specific towards ankylosing spondylitis is a blood test called HLA-B27, which stands for human leukocyte antigen B27. And this is a surface antigen on white blood cells that and it measures the amount of that protein in your body on the white blood cells. And a positive HLA-B27 means that you have a greater risk of ankylosing spondylitis. But again, it's not in and of itself the diagnosis. So doing one single blood test of HLA-B27 and having it positive is not by itself how you diagnose it, but it does mean you have a greater risk. And with the right signs and right symptoms and right radiographic findings, can be consistent with it. And there are a few other conditions which can also have a positive HLA-B27. Like I said, psoriatic arthritis, reactive arthritis. There are a few other types of conditions. So just consider all those things. And again, working with your doctor to sift through all of your signs, symptoms, labs, and other studies. And so I said I'll talk about the labs, and then the other part of that is imaging studies. And there are a few different types of imaging studies that are done for ankylosing spondylitis. And it usually consists of X-ray, maybe CT, or MRI. And probably in most scenarios, you're going to start off with an X-ray just because that's a little bit more feasible, a little bit more affordable. And X-rays are going to show you erosions and changes in the joint on how wide the joint space. And there are a number of other different things that they're going to look at. Diagnosing ankylosing spondylitis with an X-ray can be a little bit more subtle, and sometimes people even classify them differently on different types of the disease based on whether you can see the disease present on an X-ray or not. Now, an MRI is going to be able to pick up smaller changes and see other things like fatty changes or subtle structural changes, inflammatory changes. And in scenarios, you may need to do an MRI. Your doctor may want you to do an MRI, but it's really an individualized decision on what test to do or in what sequence. Some of these tests can have false positives, meaning they might have findings that look like it is ankylosing spondylitis, but you may not actually have that. And so sometimes people go for other things that they're getting an X-ray or an MRI for, and then it's noted that some of these changes may suggest this, but you never have any of the symptoms. So again, it does not mean just because one of those things comes back positive in and of itself that you have ankylosing spondylitis. It's one part of the diagnosis in conjunction with the signs and symptoms and the blood work. So that's a little bit about the diagnosis background. And we also need to talk about treatment options from a Western perspective. And then after that, I'm going to jump right into the Chinese medicine perspective, and we'll talk about treatment options on that side too. But from a Western traditional allopathic medicine perspective, the goal of treatment is to help you be functional, limit the amount of pain you're having, enable you to do your regular activities, and prevent progression of the disease so that you can hopefully prevent eventually needing surgery. So those are some of the big picture goals of the treatment. And there's a few different ways that we try to go about that in ankylosing spondylitis. I would say the first thing in ankylosing spondylitis is smoking cessation. So smoking is definitely correlated with ankylosing spondylitis. If you have ankylosing spondylitis and you do smoke, that is the first thing you need to work on. We often think about smoking as causing lung disease or heart disease or strokes or lung cancer, and those are all true. We don't often think about smoking causing spinal problems or joint damage, but it can. And in ankylosing spondylitis, if you do have it, then that is a big thing that you need to stop on. It is a universal recommendation to quit smoking if you have ankylosing spondylitis. I know that's a lot harder done than said, but that is one of the first line things that you want to work on. The good news is that is something that Chinese medicine can also help with. So if you are in that boat, I would consider Chinese medicine and acupuncture and herbal treatment for that. Now, beyond that, if you are not a smoker or you have already done that, one of the other common universally recommended things is exercise and physical therapy. So, like I said earlier, the type of pain in ankylosing spondylitis typically gets better with exercise. And so, one of the most important aspects of treatment for ankylosing spondylitis is exercise and physical therapy. It's some of the goals are to improve your posture, improve stretching, help work with help work on muscle imbalances. That's something that a physical therapist can especially do. A lot of times we have muscle imbalances based on ways that we carry ourselves and the posture we use that we don't necessarily even realize. Or you may be somebody who exercises and you're over exercising on one set of muscles and it's causing an imbalance that is straining your joints and straining the lower back. And that could also be part of your ankylosing spondylitis. So, exercise, physical therapy, um, those are two things that are going to help you and not really hurt you. So those are two things that we do before we get into medication treatment. Now, when it comes to medications, there's a couple different classes. There's actually a few different classes, and I'm not going to get into all of them because there are numerous. And honestly, people can do hour-long lectures on just that alone. But the I'm going to just talk about the first line and maybe a little bit of the second line treatment. But first line for ankylosing spondylitis is NSAIDs or non-steroidal anti-inflammatory drugs. And these are drugs that you are all familiar with. They're the over-the-counter pain medications like ibuprofen, Motrin, naproxen, Aleve. They're the stuff that you can get over the counter easily without a doctor's prescription. And there are different types of NSAIDs, and they work kind of like their name described. They reduce inflammation, they are anti-inflammatory, and they are not steroids. And so they are pretty much recommended as first line treatment in ankylosing spondylitis. You do typically need higher doses to get good treatment results in ankylosing spondylitis. A lot of times, your doctor is going to recommend you to take the highest dose of whatever type of NSAID that you are using. They do have side effects if you take them for an extended period of time. They can cause stomach ulcers. And so it is something that you do need to talk to your doctor about and have a plan with them on what dose you need to be on and how long you need to be on it. Sometimes doctors will want you to be on it intermittently if your pain symptoms are not too bad and you don't need it all the time. But in some scenarios, your doctor may want you to stay on it indefinitely. So it's really important to work on that with your doctor on an individual basis for your situation. Now, beyond NSAIDs, there are a lot of other medications, and there's a lot of newer drugs that are available for ankylosing spondylitis if your symptoms are not well controlled with just NSAIDs alone, and you need to have a step up therapy to a stronger medication. And like I said, I'm not going to go into a lot of detail on these medications. They are a little bit more advanced medications. They have a little bit more risks and more side effects. If you are on these medications past NSAIDs, you should be working with a rheumatologist to find the right medication for you. But some of the common ones that are used are medications like Humira, Enbrel, Remicade. Those are the trade names, and they are uh, tumor necrosis factor inhibitors. So, class of medication that can be used in different types of arthritis and ankylosing spondylitis, especially. So, they do have more risks. They have a little bit more side effects, but in patients who don't have adequate relief with the first line treatments, then it is something you want to consider. And the reason you want to consider it is because, like I said earlier, the goal is to prevent long-term joint damage, um, which is what you're trying to do when you use these medications, improve your quality of life, help prevent surgery, and And so that's something you want to work with your doctor on to see if those medications may be beneficial for you for those circumstances. Last thing, and I'll mention it pretty briefly, is in intractable scenarios where the other medications haven't been working, or you've just had a lot of joint damage, either before you got on the medications or while you've been on the medications, um, is surgery. That is one thing to consider. Um, some patients just don't have the relief from the medications, and while we do have a lot of great new medications, it's still not perfect. And in some scenarios, surgery is a necessary treatment option. And that could be hip replacements, it could be spinal surgeries. Again, it depends on exactly which joints are affected in your circumstance, how severe it is, and other factors like whether you are a good surgical candidate or not, whether you can tolerate anesthesia. So it's a very individualized approach, definitely far outside of the scope of what we're going to get into here, but it is a option. And in general, we try to avoid getting into surgery for as long as possible. But if you do need to, that is something that that is available. And I'm sure if you are at that point where you are having severe disease, or maybe it's not that severe, but it's something that you're concerned about, you might be considering other treatment options or what else you can do in it in addition to those. And that may be why you are here listening to the options in Chinese medicine. And so we are going to transition now to talking about Chinese medicine and what it can offer you in addition to traditional medicine and traditional allopathic options. So, um, in Chinese medicine, in ankylosing spondylitis, um, there could be a number of different reasons that somebody develops ankylosing spondylitis. And ankylosing spondylitis is not really a Chinese medicine term, but it it is something that we can use to help understand the direction we're going in or what we're treating. And so for the portion where we talk about Chinese medicine today, I'm going to use the illustration of one of the types of etiologies that can cause ankylosing spondylitis. And for illustrative purposes, I'm going to use the example of dampness and heat in the body. So a number of different things can cause ankylosing spondylitis in Chinese medicine, but one of them is what we call damp heat in the body, and especially in the lower part of the body. And so when I use the term dampness, what we're talking about is the kind of like the humidity level in the body, how much water content is in your body. If you have too little water content, that causes dryness in the body, and that causes its own set of diseases. But if you have too much water content in the body, it can cause dampness, and that can have its own health problems. And so when we talk about dampness in Chinese medicine or damp disease, we're talking about too much water accumulation in the body. And it's different from just how much water you drink. Sometimes people think, oh, I drank too much water, or I didn't drink enough water. That's what caused it. Not exactly. That can be part of it, but not exactly. It has other things to do, your metabolism, the environment you live in, diseases, other diseases you may have, the diet that you eat. All of those things can impact it. So dampness is one type of pathogen in the body, and then the other one that I talked about is heat. And so temperature is also something that we regulate and concern ourselves with in Chinese medicine. If your body tends to be too warm, you can have hot disorders. If your body does not have enough warmth, if it tends to be too cold, you can develop cold disorders. And then those disorders can then combine with each other so that you have dampness and heat, and hence you have damp heat disorders. And that can be more complicated conditions. And the other thing we look at in Chinese medicine is just where is the disease located. So when I say you have dampness and you have heat, well, it could be in numerous different places in your body. It could be in your spleen, it could be in your kidneys, it could be in your lungs. And again, that will affect the type of disease that you will particularly manifest. And so specifically for ankylosing spondylitis, one of the common conditions we see is damp heat in the lower part of the body, and especially in the kidneys, and also affecting the spleen. So both the spleen and the kidneys is one of the example. And if you do have damp heat in the kidneys and spleen, there are different treatment options specifically related with the acupuncture protocol we use and then the herbal protocol we use. So in acupuncture, um, for ankylosing spondylitis caused by damp heat in the kidneys and in the spleen, I tend to use points that target the kidneys. In Chinese medicine, the kidneys have a close relationship with the bones. It is said that the kidneys produce the marrow and they govern the bones. So you can almost think of the bones as like an external manifestation of the kidney organ. Well, I guess it's not really external manifestation, but a outward manifestation of the kidney organs. And so the relative health or weakness of the kidney manifests itself in the bones. So using acupuncture, we target the kidneys and we target points along the kidney channel to strengthen the bones. And that is a major part of the treatment course. And that's also why if you come in with low back pain or ankylosing spondylitis, the points that I use may not be right there where your pain is on your lower back. It might be somewhere else. It might be on your leg, it might be on your abdomen, somewhere else, but it might be on a channel that is part of the kidney channel, and it's being used to specifically strengthen the kidney and strengthen the kidney organs and thereby improve the bones. So that's one example about acupuncture. And then I was going to just talk a little bit about herbal medicine and Chinese herbs for ankylosing spondylitis, and specifically damp heat in the lower part of the body, the kidneys and the spleen. And there is one formula that is a ideal example of this treatment, and it's called Miao San, or which translates to two marvel powder, Miao San. And this formula consists of only two herbs, actually. It's made of Kangzu and Huang Bai. And these two herbs actually work in an integrated way to specifically treat dampness and heat affecting the kidneys and affecting the lower organs of the body. And it's known historically in Chinese medicine to treat low back pain and weakness in the legs, and even in more severe scenarios where you can have atrophy in the lower part of your body and develop weakness. And so I think it's helpful to understand how these herbs work together. Like I said, there's two herbs. The first one, Kangzu, is an herb that actually acts on the spleen. And what it does on the spleen is it helps to lift the spleen and lift the energy of the spleen. And when it does that, it gets rid of the dampness in the spleen. So if you have dampness affecting the spleen, then this is an herb that can help with that. And as you get rid of the dampness in the spleen, it improves the spleen's ability to function, and it connects well with the kidneys. The spleen is what helps to prevent the kidneys from and the external body of being affected by dampness. The spleen helps to control the muscles in the body. And so Kangzu is an herb that's going to lift the dampness off of the spleen and allow the body to begin metabolizing better and nourish the muscles, strengthen the lower part of the body. And then the second herb that's part of that combination is an herb called Huang Bai. And Huang Bai is a cold herb. Now, I just talked about how diseases have different temperature uh, constraints. So you can have heat, you can have cold, and it's the same with herbs. You can have cool herbs and you can have warm herbs. And Huang Bai is a cool herb, and it's an herb that helps to rid the body of heat, and it also clears dampness, and it especially focuses on the lower part of the body, especially the kidneys. And so in ankylosing spondylitis, you could have dampness and heat affecting the lower portion of the body and affecting the kidneys. And so Huang Bai is going to go to the kidneys. It's going to get rid of the dampness and of the heat and work together with Kung Zu as Kung Zu lifts the spleen and helps to rid the body of the dampness. And so in ankylosing spondylitis, if your situation is related to damp heat, which we would need to evaluate you and consider your other symptoms and signs, look at your tongue and pulse and put it all together. But if it is related to damp heat, then this is a formula that may benefit you. So in conclusion, ankylosing spondylitis, it is a difficult problem. It can be debilitating for many people. And if you have ankylosing spondylitis and you are interested in looking for treatment options or in addition or beyond the standard treatment protocols that are offered in Western medicine, I think acupuncture, Chinese medicine is a fantastic option to consider. And at our clinic, Houston Acupuncture, I have a background in allopathic medicine and Chinese medicine. We are uniquely positioned to help understand your condition more fully, make a treatment plan that looks at your health and considers your health and your body in a more holistic manner. So if you are interested in learning more about what we do or what our treatment options are, find out more at www.houstonacupuncture.com. That's www.houstonacupuncture.com. Reach out to us, find out if our services are a right fit for you. It was good talking to you all today, and we will see you next time on the East Meets West podcast.